My name is Matthew Summers. I'm the Program Director of Structural Heart at Sentara Heart Hospital, an interventional cardiologist and structural heart physician, and I do structural heart procedures, including transcatheter aortic valve replacement and transcatheter mitral and tricuspid edge-to-edge repair. From a program perspective, we use DASI as our pre-procedural planning in the vast majority of patients with any sort of high-risk features or complex decision-making that's necessary. So in the traditional sense, when I trained in TAVR, it was understanding the patient's CT scan and the annular anatomy and some of the things that we can head off with very, very precise cardiac imaging on the front end, some of the complications that we can head off. But it remained, even with the precision and the resolution of CT scans and a lot of measures that we've used historically, fairly rudimentary as far as the predictive level of those things, the test characteristics of some of those numbers that have been developed over time. We have been using DASI for the last year, and it's made significant improvements in our ability to head off and predict some of the worst types of these complications. We've found tremendous value in using DASI to give us better predictions, better assessments, better reassurances that some of those procedures either aren't necessary or that the risks and the concerns that we typically have, that's not as much of a risk based on better predictive modeling has been tremendous. This is traditionally how we look at a CT scan. So high resolution, we're looking at in his particular scenario, what's typical for radiation heart disease is this extensive annular calcium pattern that extends down into the aortomitral curtain into the left ventricular outflow tract. So the risk of annular rupture is significant just looking at his valve. And that's going to balance with what size valve we would put in and what type of valve we'd put in with TAVR. Having the ability to be more precise on the front end to plan and mitigate some of those risks and demonstrate feasibility in the future has been really what has prompted us to use this type of predictive modeling, DASI in particular, on the front end with the vast majority of our patients that come through our program. You can also see the symmetric sinuses or neosinuses in the cusps. The commissural angles are all symmetric, and so it gives us reassurances that the stent would expand to a functioning level to allow for a good level of valve function and also not have significant gaps or paravalvular leaks. From our standpoint, it's been incredibly helpful to give us more precision on the front end, to help individualize therapy on the front end, and also have reassurances in 10 to 15 years for the patients that they will have options open for them based on as much information as we can possibly gather to look at reintervention feasibility in the future.